Yep.
Good. All right. Okay, Laura, so you can go ahead and take roll call.
Shelley Entricken, Barb Long, Audra Miles,
Here.
Joe Coffin, Craig Boynton,
Here.
Hannah Fuchs, Dave Luders,
Here.
Mary Patton, Tracy Dowell, Renee Razzo, Megan Brake,
Here.
Max Schneider, Tyler Rogers, Dawn Harper,
Here.
Jody Scott,
Here.
Dr. Shamra Robinson,
Here.
Angel Marinich, Kylie Rathman,
Here.
Chris Mitchell, Connie Shiley, Jim Bremner, and Greg Cassidy.
I see him on, but
Did we-
Greg, I didn't hear you, but I see that you're there. There we
Okay.
Yeah, sorry. Thank you.
go. There we go.
Thank you.
All right, so we don't have an in-person quorum. In the past, we have defaulted to our urban subcommittee. However, we always do that, so I've hoped that to be kind of a last resort, so I'm not gonna do that today, because it's not really fair to lean on one side. And I hope that we can get more people here, but I do recognize that it's a big challenge to travel so far. So, in the meantime, I will recognize anybody else who is present, so I'm just gonna say your name if I didn't say you around the table. So we have Kofi Kisei from the Greater Peoria Mass Transit District. We have Melissa Orwell from IDOT, and that's everyone else in the room here. So I'm gonna go online. We have Katie Dedman from the Western Illinois Agency on Aging. Let's see, we have Lonnie Baker from the Stonehays Sill. Who else? And I see there are two that show up as callers. Could you say who you are?
Ed Heflin from RTAC.
Excellent. Welcome, Ed. Was there another? Go ahead. Was there another caller? Okay. All right. We could have already. It could be one person that's logged in. Okay. All right. Well, thank you, everyone. And we will move on to public comment. Do we have any public comment today? All right. Seeing none, we'll move to agenda item 3, approval of August 6, 2024 minutes. We can't do that. We can't approve them today since we don't have a full quorum, but if anyone has any comments, I'll take them. All right, until next time. So we will roll right into agenda item number 4. So I will share my screen. Okay. Get this PowerPoint set up here. There we go. All right. Okay. So I'm going to give a presentation about non-emergency medical transportation. And I will say that I am not the expert on this subject. I've learned what's on these slides, so I do know some. And I recognize that probably many of you are experts on this, so I would love to hear anything that I missed. So knowing that, I'm still gonna move on because I know some folks don't work with this topic at all, so it could be a learning experience. I'll start off by saying that the content in this slide was put together by Riley Anderson. She is the Assistant HSTP Coordinator for Regions 9, 10, 11. That is the whole southern third of the state of Illinois. So if you think that our region is big, you should see down south. They have a whole lot of agencies. So we're going to learn about non-emergency medical transportation today. The basis of this set of slides is a document called the Medicaid Transportation Coverage Guide. And this was produced in September 2023, so just about a year old, and is a collaboration between the U.S. Department of Health and Human Services and the Centers for Medicare and Medicaid Services. So it's meant to be a one-stop source for guidance for how to show the federal requirements as well as the state flexibilities within this NEMT field, and then specifically regarding Medicaid's transportation assurance. And the key here is to allow states to provide beneficiaries greater access to Medicaid benefits. So as you might know, if you're part of Medicaid, then you do have a list of benefits, but actually accessing them is a big challenge. And to understand how to do that, there's a lot of collaboration that needs to happen, a lot of documents such as this that help guide. So, as I mentioned, this is non-emergency medical transportation, so NEMT, and this is, it's basically, it's not any sort of ambulance trips, and it is specific to Medicaid. So, related to if someone does not have another option, this is where public transportation agencies come into play. So each state administers its own Medicaid program within the federal guidance. So if you go to any other state, then these specific NEMT rules are different because as the government, we do have to complicate things. So NEMT is jointly funded by the federal and the state governments because you do need both levels to be able to more effectively plan for that localized area. And states are required to assure NEMT for approved Medicaid services. So really the states are in control, utilizing the federal guidance. So the Medicaid perspective for NEMT. Medicaid, as you likely know, is a joint federal and state program that provides health coverage for individuals and families with limited incomes and resources. The reason why we're talking about it today is because some of the key populations in this HSTP realm, we look at seniors, people with disabilities, people with low incomes, veterans, anyone who needs extra assistance. So this would be the low income population. So this is the NEMT benefits Medicaid beneficiaries who need to go to and from pre-approved medical services and have no other means of transportation. So this is a last resort. They will not pay for anything other than what is actually necessary in that specific scenario. So continued, public transportation agencies are recognized as viable NEMT options. So they are, as the rest of the slide shows, that they are seen to be the most suitable and economic means of providing transportation. And that's key because the main focus areas is that they must be the least costly and most appropriate mode. So both of those things, not just the cheapest, but both of those things. And they provide transportation to the nearest qualified provider. So this attempts to make sure that people aren't shuttled far out of the region when they don't have to be. Even if maybe that's the cheapest, but it might not be the most appropriate So here is yet another acronym. So a managed care organization. And this is a healthcare provider that delivers integrated and quality managed care to enrollees and receives a set monthly fee per enrollee. So enrollment in a MCO is mandatory for most people who receive Medicaid assistance. So I only put this here to show it because MCO is referenced in this presentation and other materials when talking about an EMT. So that is a managed care organization. So why should we coordinate an EMT with our human service transportation? It's really the same reason why we meet today, why we hope to. Our main goals are to collaborate and understand all the different sides of the issue. There's no way to have a one-size-fits-all, especially across urban and rural boundaries. And there's always new cases that come up with different types of people trying to get different locations. So really the key is to partner and discuss transportation options, and it just furthers collective understanding. The more that we work with different types of folks and organizations, understand what is available, what's able to be done. Thank you, Jody. Closing the door here just to minimize extra noise. All right, so yeah, just furthers collective understanding, allows people to understand where the other party is. We've got someone on. Hold on, I'm sorry. I have only one screen here, and the problem has solved itself. Perfect. So I will hop back to the slideshow. So, moving forward, the way that NEMT services work is that there is a brokerage program that's under contract with individuals or entities. And this needs to happen through a competitive bidding process. And this is the coordination services that must be efficient and cost-effective, and there must not be a conflict with the policies and rules of the Medicaid program. So there's allowed collaboration there, but it's very strictly regulated. And like I said, Medicaid is a payer of last resort. So Medicaid really only pays for the covered services when there's no other third-party payers for the same items. So you have to really try and find any other way, and then this will pay for the very last option. So rural areas are a special case because more time and distance are needed in rural areas to provide our transportation services. So just simply the distance has its own special case. And based on that, CMS, that's one of the organizations that I mentioned earlier, in this set of the document that I'm referencing here, they strongly encourage states to evaluate the rate methodologies that recognize rural transportation providers. And specifically, states do have the flexibility to set higher base rates or establish supplemental payments for rural service, because it is understood that they kind of have to go, they literally have to go the extra mile in providing that service more than urban areas do. And so as an example, a transportation provider may travel many miles to cover the location that they need to cover, and they could, it might mean that the provider is not able to transport any other beneficiaries or other riders. So that takes up extra time and resources on the transit perspective. And if there is a no-show, then it would cost them more because they have allotted more time, more distance than they would have otherwise. And they couldn't, and they had to maybe rearrange their schedule around a specific person. Okay, so we're moving right along. Provider payments.
So these are costs that cannot be paid as a direct activity, but can be built into a payment methodology. So if you work for an organization that has indirect costs listed in the budget, then that is all of these things. So anything that could go wrong, could take extra money, take extra time, is worked into this payment overall. So no load miles. These are what are called miles with no beneficiary on board, nobody's riding. Often referred to as deadhead. So this is when somebody, trip A, on the way there, they are dropped off at a place, and then when they return, the vehicle has nobody in it. So if you hear the word deadhead, as well as no-shows. So these no-load miles can be included in the negotiated rate. So even though we know these happen frequently, it'll help to wrap them up into that. And then rates may be no more than what is charged to the general public, and states are afforded flexibility for coverage of wait times. So again, even though there's a big major structure involved in this whole process, there are flexibilities because it's understood that these things happen. And I like the quote below: the fiscal burden of transportation must not be unfairly placed on paratransit. Okay, so one more slide for this one. Medicaid does allow for trip sharing. However, it only pays for its portion of a coordinated trip. So that means if I'm just going to Kroger and someone else is going to their doctor's office, we're in the same vehicle, then it will only pay for that leg that will take that person to their doctor's office. And Medicaid must not offer payments too low that it results in a limited number of potential service providers. We need to have options available. And then again, states do have flexibility to explore a broad array of innovative payment models. So these guidance, they list different options, but maybe there are other things that we haven't thought of, anything that can be added into this process. And then, so these 3 points apply to both ADA complementary service as well as public demand response transportation. So they must be reliable and timely, they cannot exceed the fare, and no more than the rate charged to any other state agency for comparable service. And I believe this is the last major slide. So other helpful information. So I said earlier about lowest cost and most appropriate. This guidance introduced, or I would say specified, that it does also need to be the most appropriate, because historically decisions were made based on just the lowest cost, which is sometimes the least appropriate, as maybe you know in your day-to-day. So like I said, this is what the guidance is challenging the state Medicaid directors is to consider both costs and appropriate. So it was previously thought that it's prohibited to negotiate rates, but this guidance gives agencies the opportunity to negotiate with the managed care organization. And then finally, for an ADA paratransit trip or a public demand responsive trip, the transit agency can collect the cost of a trip rather than the fare for the trip if it negotiates from that rate. So there's a whole lot. There's actually, I can send, if folks are interested, presentations on this that are like tens of slides. So there's so much more information, but I wanted to give kind of a taste of non-emergency medical transportation. I guarantee that folks in the room and online know a whole lot more than I do. But knowing that, I'm going to cancel out of this so I can see the people online. And I will open it up for questions. I will say that Ed Heflin from RTAC is a big expert in this topic. So if I cannot answer a question, then he is on the line and available. Well, Ed, would you like to add anything more? I know there's so much more to add, but maybe as any other remarks you think are relevant here?
I can probably add a couple of small things. The Medicaid NEMT is administered by the Department of Healthcare and Family Services. They have something called the Non-Emergency Transportation Prior Authorization Program. The acronym is NETSPAP. And HFS contracts with First Transit to help manage that NETSPAP program. So First Transit is the official call center for matters concerning Medicaid transportation. And for Medicaid recipients, they have two choices in requesting a ride. If they have an MCO, the recipients request a ride and it's assigned through a portal to a private transportation provider or a public transit system. For folks that just have a Medicaid card and not assigned an MCO, they can call First Transit and request a ride. And then First Transit will authorize it and assign the ride to a private transportation provider or a public transit system. I don't know what the I'm not sure I know what the current rates are now, but I can tell you what they were increased to a year or so ago. First Transit pays a base rate of $20 if the customer is ambulatory, $30 if the customer uses a wheelchair, and $20 for an escort, and then they pay 80 cents per mile. As far as MCOs, the base rate is $20 and per mile rate for $1.40 per mile for ambulatory customers and $1.50 per mile for wheelchair. So if you're a public transportation system or a private provider, you sign up with Healthcare and Family Services to become a provider. I can't speak for all populations, but I know for individuals with disabilities, where I work with quite a bit, that probably the two main issues they face are that not all rural transit systems are Medicaid providers, though IDOT is working to try to get most rural transit systems signed up to do that. And then as far as private providers, I can just give you some anecdotal stuff. Sometimes a private provider will be assigned a ride and they get a better paying ride come up, and sometimes the customer's sitting there waiting for the provider and they don't show up. But I do know that HFS and First Transit have procedures to try to minimize those types of issues. It's a very, very important service, and I will tell you that it's very lucrative for rural transit systems that do this, because it pays well. You have to make sure you keep on top of getting your money, but it pays much, much more than if you're just charging somebody a fare. So those are just some basics. Everything else you covered is quite well reminded, so it's a pretty good overview of what happens.
All right, thank you. We've got one question here. Go ahead, Kylie.
So Ed, when you say private, does that mean that Medicaid contracts with like taxi cab companies or even Uber? Or is this all?
Well, yeah, that type of thing, or it could be, let's say you have a relative that's a Medicaid recipient and the person's just having a hard time finding the Medicaid NEMT. An individual can sign up to be a provider. They have to go through the process of filling out the same forms everybody else does. If you're a rural transit system, your drivers don't have to go through the training that has to occur because of the training they receive as Section 5311 recipients. But if you're a private provider, whether it's a taxi or an individual or whatever, they have to pay for a training in which most of the topics that are covered for rural transit providers are also covered in this training for private providers.
Interesting. Kobe?
So, First Transit was bought by Transdev, I think, about a year ago. Would that be a different First Transit, or because the First Transit is now Transdev? Has anything changed in that regards?
First Transit's just an agency that assigns rides. I'm not sure if I was answering your question or not.
Maybe they are two different entities.
It doesn't provide the service themselves.
Okay.
Yeah, I don't know. All right.
I was gonna ask, are you open to having presentations done in this meeting?
Yeah.
And it wouldn't relate so much for buses, but I'm on the Women's Fund Advisory Board. And so there's a lady that she's the executive director of Lifeline Pilots, and she handles the non-emergency medical transportation, but it would be for people that need assistance to be able to fly out in different areas of the country, and it's for free for service.
It has to be 100 miles or over one way.
So would you be open to something
Yeah.
like that, and I can
Sure.
contact her and see if maybe she can give a presentation on that?
Yeah, that'd be great.
Okay.
All right. Jody, you had something?
Yeah, and if somebody signs up to be a Medicaid provider, can they do it just for that one individual that they're working with, or are they opening themselves up for other calls?
Well, just be for that individual in your family, if that's what you want.
Okay.
You could tell them that. They're not gonna make you take other people. Actually, they are in a constant state of trying to recruit providers. So I think if somebody would sign up and just want to be a provider for a family member or friend, that's still gonna help the state provide the service. I don't think there'd be a problem with that. They don't make you sign a contract that you'll receive, or you have to take anybody and everybody that they call you about.
Okay.
So if you were to sign up to be a private provider, and I know this would be a question for a lot of people, how long would it take you to receive the funds for that service? Does that come from Medicaid, or does that come from?
DHS pays, HFS is the administrator for all this, and DHS pays. I do know that years ago, there, under different administrations than the administration you have now, the wait was sometimes long, but I don't believe that's the case anymore. Plus, I know somebody in the rural transit arena that really knows how to get the payments very promptly, but I do not believe that the problems that existed years ago. I think payment is pretty quick, and the thing is, for public transit systems, it's a huge thing for local match. I mean, it provides significant local match, and one issue that's popped up has been the fact that IDOT likes to see at least 50% of the system's rides go to just members of the general public that are calling for rides. There have been some rural transit systems who they found out how lucrative this is, and so they're turning away public rides and they're trying to provide mostly Medicaid rides, and that's not what IDOT wants. So you gotta balance out what you're doing. There's still a way to garner significant local match, but you're still, if you're a public transit provider, you need to be providing general public rides rather than doing something like, oh, I want 75% of all my trips to be funding streams that can be local match. IDOT doesn't want that.
All right. I think I see a couple chats. Oh, shoot. Well, I see the chats now and they're far too late. I apologize. That you couldn't see the shared screen. I'm sorry about that. I will send the document to everyone for sure. It was word heavy, so I don't think that, besides the visuals, there wasn't anything that you missed if you didn't see that. Sorry about that. All right, any other comments about non-emergency medical? Okay, well, thank you. We put you to work, Ed, so, we appreciate it.
Well, thank you.
All right. Okay, yes, so I will follow up with a lot of attachments in my follow-up email. So if you want to read, there's a whole lot of reading material. Okay, so moving on to provider and agency updates. Let's just go around the room in person, and then I will call on the virtual participants afterwards, so you can share anything in your agency that you feel is relevant here, something new or whatever it is. We'll start with Kofi. Do you want to share anything? Yeah, also, you don't have to.
Well, I mean, we have, Angel is not on today, but we have City Lift providing that service for CityLink, and updates in that regard. I mean, they're dealing with staffing issues, something we're working on. I spoke to her just before this meeting. They would need about, let's say, 40 or 42 drivers to provide a full service. As it stands, they are short by about 10. But hiring is an ongoing process. And we're looking at other things that will help with retaining the people we bring in. So it's a work in progress. But that's a big challenge. And I think aside from that, yeah.
Okay. All right. Kylie, any updates?
Our agency is expanding with our client count, and with those clients, obviously we need more associates to fill the job orders. But with that being said, these clients are, we're finding new clients that have third shifts. So again, I'm having issues with helping people. I mean, we have clients within a 30-mile radius of our office, which is in Peoria Heights. So that's like more Pekin, Mapleton, I mean, just 30 miles around. Not so much, even the ones that are in town, because I do have a new client that's in town, right downtown actually. But their third shift is going to pose a problem with their scheduling because it is 410s. So when they get off at 4 in the morning, they have no way to get back home, wherever they're living. So I'm still struggling with trying to find providers or affordable ways of getting people to and from work that are on those shifts or have schedules that are outside of bus schedules or routes or things like that. Cabs are just ridiculously high anymore. Ubers, those are few and far between anymore. I don't know what happened, but sometimes you can't even find one unless you're ordering food. But if you're trying to get like a ride somewhere, that's kind of hard depending on the day and time. Time of day, I'm sorry. But yeah, I'm getting a lot of qualified people coming and applying for jobs that just because they don't have a car, I can't give them these jobs, which can improve their lives, which would improve the economy. So, any suggestions would be great, but that's my update.
All right. Thank you. Jared?
Nothing pertinent that pertains to this topic or like meeting. I'm just going through my own stuff as far as like vehicle maintenance and trying to make sure everything's up to date on my end as far as transportation.
All right. Sounds good. David, anything?
I don't, maybe Tracy does.
Okay, thank you. Melissa?
Yes, so for IDOT CBP, we're getting ready to release our annual vehicle certification form. It's currently in review as we've made some changes with our forms department. So once that is released and we're able to test it, we'll be sending that out to all the agencies who have our 53-ton vehicles. There's 2 new items on the form that we're including this year with the increased cost of vehicle prices and our funding not really changing for CBP that we receive annually, it's gonna be more and more important that we are doing our best to maintain the longevity of the vehicles we have and get the most out of their use. So some of the questions we're adding relate to any service changes your agency might be experiencing, and if that's resulted in a need change for any vehicles that you have that are 5310. In the event that you need more, we have area where you can mark that. In the event that you need less than what you currently have, we also have an area where you can mark that too, to where we might be able to reallocate a vehicle to another agency in need. We're also adding a question that relates to, again, if your service has changed and maybe your vehicle type needs have changed. In the event that you maybe have needed vans in the past, but now you need light duty vehicles, or maybe the opposite is true. We are looking to essentially use these forms to identify agencies to where maybe we can look at doing a swap to meet everyone's needs in the event that your service needs are changing. We want to try to work to optimize the fleet that way. Other than that, for vehicle delivery timelines, though it's not looking like the 12 to 18 months we'd initially thought, it's looking like it'll be sooner. We're still waiting on concrete timelines for the manufacturing of the new vehicles. And for defensive driving, we've had an uptick in accidents with our vehicles, so we just want to send out a reminder to all agencies, throw in extra defensive driving training for any of your drivers. Though we understand it may not prevent all, accidents, it can certainly help mitigate some unsafe behaviors that could lead to those accidents. And also a reminder that if your agency does have an accident in one of our vehicles, we do need to know within 14 days as well. Another thing, I just got a response here. As far as the first transit question, it is now TransDev. Yep. And that's all I have.
I have a question.
Yes.
Where do you find the defensive driving training?
Yes, so there is training that you can get through, there's a couple things. You can get it through.
It's on the website.
Like IDOT, just specific IDOT?
Yeah, it'll give you different options for their defensive
So,
driving.
yeah, so IDOT has some RTAC. If you go to their website, they offer tactical trainings on defensive driving as well. I think even National RTAC might have some stuff on there too for defensive driving. So there's those different resources as well.
Okay, yeah. I can dig and find those and send the links in my update. Thank you. Yep. All right, going to the other side, Dr. Shamma Robinson.
All right, so I will be talking about the community engagement side of CityLink and City Lift. So we are looking at hopefully passing, fingers crossed, a resolution for free fare, and that would be closer to the end of October. That would be for early voters because we really want to be able to drive people to the polls. So that would be for all routes, and it would go all the way up until November 5th, but we have some selected dates for that. So hopefully we'll have some information for that after our board meeting, if it's approved. Next thing I have is we will be attending the Task Fest in East Peoria, and that will be tomorrow, CityLink, City Lift, and then also we will be marketing the Washington Paratransit services as well, because Jim, he won't be able to make it, so we're going to take over that for him. And then, just so that everybody knows, for the month of October, we will be providing, and we're in partnership with Caterpillar Visitors Museum. So as long as you have a bus pass, then you would be able to, and you could show it, Then you would be able to get into the Caterpillar Visitors Museum at no cost. And that's for CityLink, CityLift, Benefit Access, and CountyLink. Then on October 18th, that will launch our Stuff a Bus campaign. We're going to be having a kickoff, and that will be at the Kroger store in Lindbergh. However, we will be rotating to Kroger's all across Peoria and East Peoria. And then we're just asking people to donate canned goods, non-perishable items at the Kroger nearest to you. But at the kickoff event, we'll have some fun things in store just to rally everybody for the support. And we are partnering with Peoria Friendship House to fill the pantry for the community. And we hope to collect 12 tons of food this year on our designated Stuff a Bus that you might see rolling around some different routes, because we ended up having to wrap about a bus. We usually have like an antique bus that we use, but it's been out of service, so we actually wrapped one this year. So we were able to promote a lot earlier.
What time is the kickoff?
It starts at 10 o'clock. Mm-hmm.
Thank you.
And that concludes my report.
Jody?
I don't have any updates.
All right, Donna?
I had an IDOT inspection last month, so that went well. I also found another company here in Peoria. It's a mobile mechanic that will actually come out on your premises to work on your vehicles, your buses, vans, things like that. It's a new company here in Peoria called Piston Resolutions. His name is Josh. I can send you the information, Rima.
Yeah.
Yeah, they're really good. So they're actually new here in the Peoria area. But if anybody knows where I can go about lifts, where I can get a lift worked on, I have a bus that is, I've been everywhere, and they keep telling me there's like a 6-month wait. I went to Personal Mobility.
You're the first one?
I
So
did.
just about to offer.
Personal Mobility, yeah, he's saying 6 months wait before they can get it in. And then I went to ADA Access in East Peoria. He's saying 3 to 4 months. So I don't know if anybody else has any ideas where I can go, maybe.
I will check with our garage foreman, and whatever I find, I'll email it to you and you can
Yeah.
share
Okay.
it. Yeah.
If I find anything, so I'll do the same.
Sure.
Do you have a phone number for that piston?
I do. His number is 309-241-9413. The owner's name is Josh. So they're located down here on Adams Street by UFS. Yeah, so they've been in the area a couple of months. So they are FTA regulated. They can do inspections and stuff like that, but they're trying to get state certified. But right now they can do all federal, like trailers and semis and stuff like that. But they're currently working right now to get their license for the state part. So,
And they'll just come to where?
yeah, they'll come to your
So
location.
like the Peoria Area Transit Center, their vans are constantly breaking down, which is
Yeah.
causing havoc
Yeah.
in my life. But they would come to them and fix it?
Yep. I actually had them come out to Epic to look at a couple vehicles of mine. And yeah, so they even have a shop, and then they have the mobile mechanic that'll come out. So they're like, if you break down the side of the road or highway gone, they'll come out. They do charge $110 an hour, but like they say, we pretty much can fix anything on the spot. So, yeah.
That sounds like a good idea. The only challenge there is if your location is a union shop, where they will push against it, but that sounds like a good idea, yeah.
Yeah, yeah, but they do actually have a shop too. Yeah, that's it.
That's great. All right. Let's move to Greg Cassidy. You're the first on my screen.
Yeah, no real updates, still waiting for CARES money to come in, been in contact with my dad about that, but nothing else.
All right. How about Katie Dedman? Do you have anything to share?
Nope, I don't have any updates.
All right. Next, I have Lonnie Baker. If you're talking, we can't hear you. Oh,
Somebody did
wait.
comment
Oh,
earlier.
you're right. That was you. Okay, so Lonnie said, no microphone, do not have any updates. Thank you. All right, how about Craig Boynton?
Good afternoon. I apologize that I could not be there in person today. We have 5 SMD buses that we are waiting on concurrence from IDOT, where we'll be able to utilize the CVP program from the federal grant that we have. So we're looking forward to getting the concurrence for that so we can place that order. We are currently going through our transit study. We're getting close to being done with the route study. Our routes have not been updated in decades, and they're definitely in need. What we are finding is that we currently have 4 routes, and the 4 routes may not be sufficient to cover how our traffic patterns have changed over the years. So we're looking at 2 options that both have options of adding a 5th route, which would definitely help us. Part of that is doing away with the loop route system that we have right now, and then we would also be doing away with flag stops and going from 60-minute routes to 30-minute routes for our patrons, which I think will be a great plus for us. And then as a part of this, we'll also be looking at going out into the county to serve our full county, which will be an on-demand type service. So once this portion of the study is done, then I will transfer over and be working with Mr. Heflin on a primer process to get the ball rolling on this. We do have a IDOT drug and alcohol review coming up next week, so we're looking forward to that. We are preparing for new dispatch software training. We recently had a grant for purchasing new dispatch software, so we'll be going with CTS Tripmaster. And as a part of that, we'll also be looking at going into the Medicaid billing in the future once we get the software in place. We have been working with the local police department to coordinate dispatch and provide access to our cameras on the buses. As many of you probably have found over the course of the last few years, the general public has gotten just a little bit crazier. We are also working with OSF to provide mental health training to our staff so that they can recognize situations and kind of prepare as to how to deal with those situations as they arise, and to hopefully de-escalate situations. And finally, working on our NTD report.
Craig, do you know if OSF has specific training for that kind of de-escalation?
They do. We've been working on a service contract with OSF, and as a part of that conversation, we started talking about mental health, and they do have someone that can provide a mental health training course, and I can provide you with that information if you would like. And then there is a fee for that. It wound up being for us, it was like $30 a person.
All right. Yeah, I'll take that information. Thank you.
Okay.
Okay, how about Audra Miles? Do you have any updates?
No update.
Okay, and Tracy Dowell, anything to share?
The only thing was, I couldn't quite hear what Melissa was saying about the vehicles for the CDPs, when she thought they might be going out to the providers, or if she knew that yet.
Yes, so we initially thought it would be 12 to 18 months from the point for manufacturing timeline, but it's looking like it'll be faster than that. But we don't have a concrete timeline yet. So as soon as we do, we will be sending notices out as well. So
okay, thanks.
Ideally faster than 12 to 18 months.
Yeah, because we could definitely use them.
Yes.
Other than that, I don't have anything to report.
Okay, thank you. Was there one more person online that I missed? Maybe not. Okay. All right. So, moving on to my HSTP coordinator report. So I have been to many conferences around. I went to 2 this month, plus 1 working meeting with the Centers for Independent Living. Jody was there as well. That was in
Springfield a couple weeks ago, and I took notes, so I highlighted some of the main topics that came out of that. So these are folks from all across the state, and I'm just gonna pick out the highlights from my notes. So Dave Patton was there. He's from RTAC, the Rural Transit Assistance Center. He said that if anyone wants to use certain items for job fairs relating to transit, then he has some items that he could send. I didn't write down specifically, but I assume it's something like tablecloths or handouts, maybe something like that, that if anyone is having issues hiring, then that could help in the whole transit realm. Let's see. Several folks mentioned either a driver shortage or a vehicle shortage or both. So it's not just our region, but unfortunately it is throughout the whole state. So it's a big challenge that we're working towards. Something I thought was interesting in Madison County, so that is, I think Collinsville is the main town there. They have a new micro transit service, and so that is similar to demand response, but it is kind of a shortened timeline, so you can request a vehicle less than that 24 hours in advance. And I'm just interested to learn more, so I reach out to them, and we're going to talk more about how that works in, I think, next week. So I have just an informal conversation with them coming up. Let's see. So IDOT was there, and they are working on Next Move Illinois. So that is a statewide public transportation plan. I did bring some bus release advertising papers. So if anyone wants to grab them, these are very long things that you can include inside of your vehicles if you want. They're just giving these for free, so I took a few in case anyone wanted some. But they have a survey, and there's a QR code here that they just want feedback from around the state. Let's see. Like I said, RTAC was there. They said that they have many different types of resources, including trainings and maps that shows who provides services in what parts of Illinois. They have a rural transit glossary for links and documents and more information, resources there. Let's see. There is, I think those are the main things. A lot of discussion in that specific meeting that I thought was very positive. And the last big thing on my end, so I'm happy, sad to say that my colleague Gabriel Guevara has moved. So he moved to Chicago. He's left us, but happy for him. Also sad that he won't be here anymore. But we're trying to hire a new person in his place, so maybe you'll see a new face. And I think we're getting close to time, so I'm going to cap it at that for my HSTP coordinator report. I will say.
Too. What are you getting at?
Okay, yeah. One final thing, which I'll throw it in this agenda item, but really it could be anywhere. I would love to find a better way to hold these meetings. We've always had them here. I've tried bringing it up in the past, but there's not really one good solution because I know some folks have to drive very far. So I think just since we're running low on time, I will send items in an email based on what other regions do, and just to give some ideas of what folks are interested in and how we can help make it better, and still hopefully try to get people in the same room. It's a big challenge. But yeah, go ahead, Kylie.
And then the events that you had held at the libraries, the interactive, first of all, collectively, when you get that data, what happens with that data, and then what's the action plan from that data?
Yeah. So Kylie's talking about as part of our long-range transportation plan process, this is a big document that is federally required for our organization to do. We look at the next 25 years and we gather input from the public within Peoria, Tazewell, Woodford. That is just our tri-county initiative. So we will have a document by, I believe, the end of March. We have a deadline from the feds, and it will lay out the key themes that we heard and goals for how we can actually reach them, and funding streams, hopefully, for how we can fund them. So it's a big to-do. My colleague Michael is the one in charge, and so yeah, we will reach that point soon. Okay. Any other questions, whether in this one or also in other?
When is the next meeting?
Yeah, I just realized that I put today's date, didn't I? It's December 3rd, so that is the first Tuesday in December, December 3rd. As of right now, it'll be here, but I will let you know if that location changes.
We would be happy to host it as long as our conference is available.
Okay, yeah.
That's our last day of stuff of us. Yeah, it's gonna be like unloading that day.
Very busy.
Mm-hmm.
All right, I'll ask just one more time. Does anyone have anything else, questions, comments?
I have a comment. Just a reminder, since it is the season for helping prolong vehicle longevity, and especially with the upcoming weather we'll be experiencing, undercoating your vehicles can do a lot in rust prevention and helping the frame and structure of the vehicle last longer, and it's relatively inexpensive. I would look into, usually people do it maybe once a year or so. This would be a good time to do it right before the salt hits the roads. So that would be something to look into if you're looking to kind of, get as much life out of your vehicle. A lot of times, we're finding that vehicles are rusting out faster than anything. So helping extend that longevity of the frame will do a lot for the fleet. So just a note.
That's helpful. Yep. Okay. All right, well, we made it to the hour, and thank you for your patience with the technology and your attention. I appreciate it. So I will adjourn at 1:02 p.m. Thanks all.